good evening, and we want to greet you on tonight. And I'm grateful for those who are joining us live on Facebook or YouTube for our live discussion about COVID vaccines in the Black community, but even just enlarged COVID vaccines for all of our communities. And so my name is Reverend Sean Jones. I am the pastor of the Star Bethlehem Baptist Church right here in Ossining, New York. And we are so grateful for those who are joining us live and are coming on in. If you would help me out, like or heart, share the video tonight with somebody else in your network who is able to view your thread. That way you can share this such important information relates to health and vaccination and COVID with those in your community, your family, and your neighbors. If also, as you're sharing the video, as you're liking the video, if you would drop your name in the chat real quick, say good evening to us so we know who is present. I am so grateful on tonight to announce that Star Bethlehem has partnered with the Ossining NAACP chapter here in Ossining, New York. So we're for the leadership of Aaron Moore, who's a member of our church, as well as Melissa Banta, who serves as the health committee chairperson for the Ossining chapter. And we have had great conversation about how STAR, along with NAACP and other groups and communities, can come together to really continue to get all persons vaccinated, particularly those brown or Black, as well as just in our entire community. We want to make sure that we push to have what we call a herd immunity. On tonight, I am so grateful that we have with us Terry Lunkin, who is a nurse practitioner in our community. Terry is quite active, and we're grateful for her expertise and her passion in this area to help spread factual information. I think that's so critical. Factual information as it relates to COVID-19 and the vaccines that are available. And so as persons are continuing to come on and come in, if you have questions or comments, feel free to drop them in the chat. Terry's going to share and present some information, and then she will definitely be available for additional Q&A at the end of our session on today. And so, Terry, if you wanted to say a few more words, if I haven't said enough about you, introduce yourself to the great folk, and then we'll go from there.
Well, hello, and thank you so much, Pastor Jones, for inviting me to speak tonight. I'm delighted to be here. I'm a nurse practitioner. I've been in practice for, gosh, I hate to say it because I don't look that old, 35 years now. And I work in New York City. And since the pandemic, I've mostly been managing COVID-19 for my company, writing all the policies, coordinating our testing program, supervising all of the isolations and the quarantines. And it's been rotten. You know, I can't wait to get back to my real life of seeing my patients with shoulder injuries and earaches and not have us all stuck in our homes. And one of the reasons I'm most passionate about the vaccine is because we just have to close this book. And even though the vaccine's not perfect, the only way we're going to get beyond this pandemic is by getting as many of us vaccinated and boosted as possible. So I developed some slides, everyone. I'm not real good at technical stuff, so hopefully Pastor Jones is kind enough to flip them for me, and I'll probably talk about 20-25 minutes. And then more importantly, I'm here to answer your questions. I have on the last slide my phone number, my email. Happy to talk to anyone individually about your personal health situation. I also manage our vaccine program at my company. We have 5,000 people and we are mandating the vaccine. So I did all the exemptions, and I was joking with Pastor Jones that it took me 63 years to become an expert in something, and it had to be this rotten illness. But I'm here to listen, to help, and to answer any of your questions.
Awesome.
So we'll start with the picture of this little germ that has wreaked havoc through all of our lives. COVID-19 is caused by a coronavirus, and coronavirus has always contributed about 25% of our winter colds. But this one mutated to become something quite serious. We call it the SARS-CoV-2 virus, and it's what is the causative organism for COVID-19. So, most of you know a lot about COVID-19. Sadly, especially since Omicron, pretty much all of us know someone who've had the virus if we haven't had it on our own. But the thing about COVID is it's so variable from person to person as well as from day to day. So the symptoms do vary, but at onset, they include fever, body aches, fatigue, sore throat, nasal congestion, and runny nose. And Omicron, especially, luckily, has been found to be a little milder. So with Omicron, usually the first thing we see is a sore throat with some fatigue, some headache, some runny nose. Sometimes that's all, but you never really know when it's going to get serious and for whom. The serious symptoms include shortness of breath, difficulty breathing, chest pain, confusion, and blue lips. Those are signs that you really do need to get seen. Most COVID-19 infections can be managed at home, but those are the serious symptoms. Medical conditions tend to make COVID-19 worse. And there's a lot of different symptoms that can do that. But the ones that are most common, which unfortunately tend to be more prevalent in the Black and Brown communities, are obesity, diabetes, heart disease, lung disease, kidney and liver disease. Those can all make it more serious. So the virus first invades our respiratory tract. It's transmitted through respiratory droplets, but can infect almost any part of the body. One of the most serious complications is the pneumonia, and that when that happens, your lungs consolidate. They fill with fluid, and that leads to problems with breathing, and that's when people sometimes need oxygen, might need a ventilator, and it can lead to respiratory arrest. The other part of COVID-19 is really your body trying to fight it. When our body sees the virus, our immune system goes into overdrive, and that can affect organs from the heart to the kidneys to the brain. I have a really good friend who works in Bellevue Hospital, and back in March of 2020, when COVID was bad, they had plenty of ventilators, but they ran out of dialysis machines because everybody's kidneys were failing. So unfortunately, it's not just a bad cold. There's also something called long COVID that you've probably heard of. The other term for that is PASC, post-acute sequela of COVID. And this is when the symptoms of COVID can persist for months or even years. The most common ones are shortness of breath, fatigue, body aches, and cough. But the scary thing is, even people who have a mild COVID-19 infection can develop long COVID. And we're doing lots of studies on it and how to treat it. But right now we have no cure for it. We just treat it palliatively, which means we treat the symptoms. So another good reason to get vaccinated is we found that even if you do have a breakthrough infection, people who've been vaccinated are less likely to go on to long COVID. So I'll give you some metrics. I hate numbers, especially when they're scary, but there have been 76 million cases of COVID-19 in the US and 5 million in New York. And just last week, we hit another milestone. We passed 900,000 deaths in the United States and almost 6 million worldwide. So people say, hey, I never got my flu shot and I'm okay. We never lost 900,000 people to the flu. We lost people, 18,000, 20,000, but not 900,000. So at least 80% of Americans have had one vaccine, which is really good news when it comes to numbers. And in Westchester, we're pretty smart. 88% of us have been vaccinated. And 540 million doses of the vaccine have been administered. So while I totally understood the watch and wait approach at the beginning, we've watched and waited for a long time. And though the vaccine isn't perfect, it definitely outweighs the risks of the disease. So talk a little bit about prevention and treatment. One of the things that is best at preventing them is the thing I can't wait to burn, which is the mask. But masks have been found to be very, very helpful. And now you might have noticed the CDC is off of cloth masks. They're finally saying they're not good enough. So they are recommending cloth masks are really good when they're put on top of a procedure mask, but now they are recommending N95s, KN95s, or KR94s. So those are all better masks to keep you protected. Social distancing is important. I know when I go into New York City and I ride on the subway, I used to lunge for that first seat. Now I stand here for a little while, then I stand here for a little while. So I'm not in anybody's orbit for more than a couple of minutes. So social distancing about 6 feet away from people that are in your, I used to call it your love world. Now I call it your COVID world. You know, there are some people that you're there, you're going to be with them. But for people who are not in that circle, do try to social distance as much as possible. It's important to stay home when you're sick. I'm happy to answer questions on testing, but I'm not going to go into testing. I will say we want tests to do a lot more than they're able to do. We want them to diagnose it. We want them to screen for it. We want them to tell us when we're clear of it. And they're just not that great. They're good. They're really good, but they're not perfect. There's two kinds of tests, the molecular test or the PCR test. That's better at diagnosing the virus, especially in asymptomatic people. And then there's the antigen test or the rapid test. Those are both the in-home tests or the ones that you might get at the CVS or urgent care. And those are good at telling us when we're most infectious. However, I'm finding that people who have symptoms often test negative on that antigen test day or 1 or 2. So that's why we want you to stay home when you're sick, because you never can 100% rely on a test. I won't go to, I'm sorry, yeah.
I'm sorry, I asked you a question about that, guys. Maybe a question else is thinking right now about the testing. I know that the government, sent tests home to those who would like to. We're passing out tests at STAR to those in Ossining. So I guess the question is, maybe you're going to present it later. I apologize if I'm cutting ahead. When exactly is the best time to take a test if you think you've been exposed? Is it right away?
That's a great question. So the antigen test, the reason they come 2 in a box is not so you can share them with a friend, but because you really should test twice. And that's how you get more reliance from an antigen test. The recommendation, and if you have a lot of tests and, now insurance pays for them, Medicaid and Medicare are going to start paying for 8 a month pretty soon. They're dragging their feet, but we're putting the pressure on. You can never test too early or too often, but you can't rely on a test that's too early. So the recommendation for testing after a close contact is to wait 5 days. So if you have a box of tests, maybe do that first one on day 4. And I tell people you can get a little bit of reassurance, but really 5 days is the sweet spot. Of course, if you start to develop symptoms, then you can test earlier. And your PCR test is your best test, but your antigen tests, they're cheap, they're easy. I think most of us have popped 1 or 2 up their nose by now. They're not that painful. They used to go way the heck up there, but now they're a lot better and easier. Okay. So the recommendation for isolation, for full isolation is still 10 days. But now what we say is a lot of people weren't isolating at all because 10 days is a crazy long time to be off work, especially if you're not being paid. So the CDC, partially because of political pressure, said that if you isolate for 5 full days, and the day you get COVID is day 0, so 5 full days is 5 full days after that. If your symptoms are mostly gone, and especially if you can test and you test negative with an antigen test, you don't want to use a PCR test for that. They stay positive for weeks and weeks. You can end isolation on day 6. But I always tell people that's not the day to visit your grandmother in the nursing home. You want to be super careful for a while. They just did a really good study in the NFL, and they found 35% of people were still positive and possibly infectious on day 6. So day 10 is the best, but we all have lives and things we have to do. So you can come out after the 5 days of isolation, hopefully if you've had a negative test. It's not mandated that you test, but it is recommended.
And that's for persons whether you're vaccinated or not, 5 days
Right.
now, or is it?
Yep.
Because
The
there's
vaccination.
been some confusion with the new CDC.
Yep, vaccination does not change isolation. What it does change is quarantine. Isolation, oh gosh, I could talk forever on this. I'll try to be brief. Isolation is when you have the virus and you're staying in to wait out the infectious period. Quarantine is when you've been exposed to the virus and you're staying in to avoid the incubation, to wait out the incubation period. So if you are not vaccinated, or if you're due for a booster and haven't had one, it is recommended you quarantine for 5 days after a close contact. If you're vaccinated and boosted, if you're due for a booster, no quarantines are necessary, which is another good reason not to get vaccinated. Okay, so treatment, I won't go into it a lot, but there's some good antivirals out there. They're very hard to come by. Insurance is making it a little difficult to pay for them, but we do have some treatments. Before, we only had the monoclonal antibody treatment, but now we do have some antivirals, like we had Tamiflu for the flu. There are a couple of COVID-19 medications, but they really are reserved for people who might otherwise have a very serious infection. Okay, so now I'll go into the vaccines. There are 3 vaccines licensed for use in the United States. The first 2 are Pfizer and Moderna, and those are what we called mRNA vaccines. And we'll talk a little bit about reasons that people were hesitant, but one of the reasons people were hesitant was because mRNA vaccines are a relatively new technology, and people got all nervous that, it gets into my cell, it's going to mess with my cells. There was, misinformation around there that there's a microchip in the mRNA. That was just a very good misinformation campaign, but it was just total nonsense. But the way the mRNA vaccines work is they inject the vaccine into your muscle, and the muscle creates what's called a spike protein. That spike protein sits on the outside of your cell walls, and it sort of prompts your immune system to develop antibodies so that when you see the real virus, you won't get it. So Pfizer and Moderna are the 2 mRNA vaccines. They have been found to be more effective than the Johnson & Johnson vaccine. The Pfizer is a 2-dose vaccine. You take 1 dose day 1, the second dose 3 weeks later, and then you're due for a booster in 5 months. Moderna, you take 1 day 1, the second one 4 weeks later, and then you're due for a booster in 6 months. But those are the 2 vaccines that are more effective. The Johnson & Johnson vaccine works totally different. It's what's called an adenovector vaccine. So for some people who can't take the mRNA vaccines, for example, if I don't want to get too technical, but if you have an allergy to PEG, polyethylene glycol, you can't take an mRNA vaccine, but you can take the Johnson & Johnson vaccine. Another good thing about the Johnson & Johnson vaccine is that it's only 1 dose. So in places like homeless shelters and prisons, they often gave it because it was just 1 dose, but they found it was not quite as effective. And people who've had the Johnson & Johnson, it's recommended you get a booster in only 2 months as opposed to 6 months. And it is recommended you boost with Pfizer or Moderna. But if you hate getting poked, do the J&J, you get 2 months of protection, and then once you do the Pfizer or Moderna booster in 2 months, you're again fully protected as well as anyone who did the 3 shots. So that's one way to cut your shots back by 33%. Oops, I guess I did most of that. So side effects of the vaccine are common, so it's okay to expect them. They include fever, body aches, headaches, and fatigue. They just did a really interesting study, though, where they injected one group of people with COVID-19 vaccines, and they injected another group of people with sterile saline solution, and they found out pretty much the same level of side effects for both. So there's a question, our brains are super powerful. There's a question of, do we get side effects because we expect them? Or do we get side effects because the vaccines give them to us? I went into it saying, I'm not going to get any vaccines. I'm old. They tend to be more common in younger people. I'm going to do just fine. And I was a little fatigued. Absolutely nothing. My daughter, who's in her 20s, she had 101 fever. She felt really crummy for a day, but it's not a live vaccine, so it's not giving you a mild case of COVID. And the side effects, even though they're common, they do go away. If you've had COVID, you'll probably get side effects with the first vaccine, where if you haven't had COVID, it's more likely to get side effects with the second vaccine.
I remember my first vaccination, and even I remember saying that was the best sleep I'd ever had in my life. But I want to ask a question, if you would. I've heard people say, well, I don't trust the vaccine because you have to get boosted. What kind of vaccines require boosters? Can you explain or share why the booster is so important, or why the need for boosters now, and where we are now?
Yep. Viruses are tricky little critters. They can't live outside of a cell. So bacteria, like, let me think of a bacteria, Giardia or strep, they can live independently. Viruses can't live independently. They can only live in your cells. And as your cells start to recognize them, your cells start to get immune to them, so they mutate. The reason we get a flu shot every year is because you need a new flu shot every year, because the flu mutates. And COVID-19 is also mutating. Now, what's really interesting is the more people who are vaccinated, the less mutations we're going to see. So another good reason to get vaccinated, and clearly I'm proselytizing a little, but one of the reasons to get vaccinated is to stop these darn variants from taking hold. And one of the reasons America has to send vaccines all over the world is so that we can get the whole world vaccinated, because without it, we're going to get variants and they're going to inevitably come back to us. So no vaccine is 100% effective. The flu shot at its best was 40 to 60% effective. So the COVID vaccine is not 100% effective. And Omicron, unfortunately, is a little trickier and does have more mutations on those spike protein. So what we found is that there was a new study that came out from South Africa. People who are fully vaccinated, had 2 vaccines, but are due for a booster and haven't gotten them, have 35% protection from Omicron, which is still pretty good. That's as good as a good major leaguer's batting average. But people who've been vaccinated and boosted have 70% protection from Omicron. So boosters are super important. No one likes to get poked, but one of the things about Ossining is there's lots of great pharmacies that have them. We've worked with HealthSmart. We've worked with Walgreens. Open Door is out there. Nick at OVAC, the Ossining Volunteer Ambulance Corps, he's out there. I mean, we're all out there trying to give you that little poke so that you'll have protection. Not 100% protection. We expect breakthroughs. Vaccines are to stop people from dying and ending up in the hospital. And there was a study that found unvaccinated people are 5 times more likely to be hospitalized. And a new study found that unvaccinated people are 23 more times more likely to be hospitalized than people who've been vaccinated and boosted. That was a small study. I have a feeling, there's probably the truth is somewhere in the middle of 5 times and 23 times. But my friend who works in Bellevue pretty much says most of the people now who are on the ventilators are not vaccinated.
I want to pause right there if I can. Again, we're here with Terry Lunkin, nurse practitioner with Ossining NAACP, providing information on vaccination and vaccines for COVID-19. If you have questions or comments, feel free to put them in the chat. Maybe we can get to them and hear what you have to ask or have comments about. Again, she made a major point. Persons who are unvaccinated and unboosted, you are at a higher risk percentage-wise of being hospitalized with COVID-19. As one who I just posted, Terry, yesterday, that yesterday was my 1-year anniversary from being in the hospital for 5 days with COVID-19. I can tell you that it is getting vaccinated, getting boosted is a lifesaver. It would make sure for you and for your family as well.
And my friend who works at Bellevue, she said there are people who are dying of COVID who are begging her for the vaccine. And she said every time it brings tears to her eyes, and she has to say it's too late. It's not going to help you now.
My
So I'll go on a little bit to health inequity. Gosh, we can talk about that forever. But, the America, one of the reasons, I'm, as you probably noticed, I'm white. But one of this country has just a shameful history of racism. And there's so much, the structural racism now, I think, is so much worse than the individual acts of racism. And I mean, the inequities in the healthcare system are also shameful. African-American people are twice as likely to die from COVID as white people. Partially, it's because they have the kind of jobs that put them at higher risk. They work, directly with other people. They're working in hospitals, on buses, in subways. Also, they don't sometimes have the luxury of taking a sick day here and there and getting tested. And, then they spread it a little bit more in their community, because if you don't know you have it, you're not going to be able to protect others. Also, there is a higher incidence of hypertension, of diabetes, of chronic kidney disease in African Americans, and those put people at higher risk. What I always found is interesting is the people who need the vaccine most often, or the most, are often the ones that are the most reticent to get it. They're saying, I'm afraid of getting the vaccine because I have diabetes. It's like, no. You should be afraid of getting COVID because you have diabetes, not the vaccine. The vaccine, we have not found that people with underlying illnesses have a higher risk of adverse reactions. And when I gave flu shots, I give about 700 flu shots a year to my employees. I jokingly tell them that anything that happens within the week of my flu shot to you, including getting hit by a car, will be blamed on my flu shot. So, a lot of these adverse reactions to after a vaccine really are what we call correlational. They're not caused by the vaccine. They're probably not even affected by the vaccine. But again, I mean, Pastor Jones has been a huge advocate for this, and he's your trusted ally and is happy to talk to you about it. I'm also, happy to talk about any of your personal conditions. I know everything from the autoimmune issues to blood cancers, and what the contraindications for the vaccine are. Really, the only ones are the allergy reactions to a component of the vaccine, not seasonal allergies, not even an allergy reaction to the flu shot. So, it really is to the vaccine components. Also, people with Guillain-Barré syndrome, they probably shouldn't get the vaccine. And people who have autoimmune conditions should get the vaccine, but it might not work quite as well for them because their immune systems are already affected.
Awesome. Thank you. We have a question, Debbie Cherry, one of our members. And sorry, Debbie, for telling all your business, but we do see you here. Question she has is this. She wants to know, I'm going to put it on the screen for us. Are they also looking to have a third shot in the future for future vaccines? People want to know now, is this going to be a constant thing like the flu shot? Yeah.
they're actually working on a flu SARS-CoV-2 vaccine together. So wouldn't that be cool if you could go in starting in 2023 every October and get your COVID and flu shot together? Chances are there are going to be future shots. It really depends how close we get to herd immunity. And I mean, this illness could really, I don't think it's going to fade away. What I like to say is it's going to mild out. It's just going to become less and less of an issue. We also do need to acknowledge, and this is another talk, but COVID-19 is a bit of a lifestyle vaccine. So for those of us who have a really crummy diet and smoke cigarettes and don't exercise and don't manage our stress and we're crazy overweight and our blood pressure's high, we're the ones who are going to get sicker. So it is definitely behooves us to try to keep ourselves healthy. But Debbie, I'm afraid the answer is yes, there are going to be future vaccines. Right now, they're trying to decide, should we create an Omicron vaccine? You know, epidemiologists all over the world are trying to figure out how to do this best, but it's not going to be two and done, unfortunately.
Okay.
So I was going to go over just a few of the reasons people don't vaccinate, and then answer any questions you have. One thing that I shared this with Pastor Jones, but because of just distrust, righteous distrust of the healthcare system, African Americans had a lot more vaccine hesitancy than white Americans at the beginning. They did not want to get vaccinated. Interestingly enough, we found that as Black and brown people have gotten more and more educated about the vaccine, they have decided to do it. The white people who were vaccine hesitant were often hesitant because no one tells me what to do, and because, you know, this is my body, get your hands off it, and because I love President Trump and I hate them Democrats. Those people, their vaccine hesitancy hasn't budged. So we found the Black and brown communities have gotten smarter and smarter, where the white communities are sort of stuck in their old way of thinking. So some of the reasons that I'll just go over, one was the vaccine happened too quickly. How can I trust it? And that's a really, really valid point of view. It did come out quickly, but it came out quickly for a lot of reasons. One, and the most important in our society, was tons of money was thrown at it. There was more money to do the research. Usually when you're trying a vaccine, you know, you get one vaccine trial funded, then you complete it, then you apply to grants for the second trial. Everybody was funding these vaccines. So these clinical trials that usually run sequentially could happen side by side. So that made it much quicker. Also, the mRNA vaccines, though they're new in humans, they've been used in veterinary science and animals forever. So it wasn't a brand new way of giving a vaccine. It was just a brand new vaccine for humans. Another misconception that I hear, I've had COVID-19, so I don't need the vaccine. Unfortunately, we don't know how much immunity you're going to develop from your infection. Some people develop a very strong immunity, and we know for sure they're going to be immune for at least 90 days. Other people, especially with Omicron, we've had cases of people getting it 4, 6, 8 weeks later. So the vaccine immunity, the illness immunity, though it's good, that's what we call B-cell immunity. So if you've had COVID and then you get the vaccine, you'll have what we call the active immunity, the B-cell immunity from your infection, and then you'll have the T-cell immunity from the vaccine. So that's super good. I manage COVID-19 for my company, and whenever someone who's fully vaccinated gets the illness, I tell them you're a Superman or Superwoman for 90 days, you know, but after that, you could get sick again. So that's why it's important to boost and to vaccinate. Another one is the vaccine will affect my fertility. And that was, or I'm pregnant, or I'm breastfeeding, women's health concerns and male health concerns. At the beginning, we didn't know. We really didn't know if it was going to affect your fertility. But now the vaccine's been out a full year. And what we found is people are getting pregnant at exactly the same rate when they're vaccinated as when they're not vaccinated. What we have found does affect your fertility is a COVID infection. So if you're worried about your fertility, that's almost a better reason to vaccinate than to not vaccinate. Another thing is that the mRNA vaccines will mess with my DNA because everyone hears RNA and we know DNA, and it's also complicated. And how the heck do you know? So the mRNA vaccines never get into your cell. They create that spike protein, and that sits on your cell wall. And that's what creates the antibodies to repel the real virus if you get it. It never gets into the nucleus of your cell where your DNA is stored. So it's physically impossible for the RNA vaccines to mess with your DNA because they just don't get to the same part of your cell. Once the messenger RNA gets in your body uses it to build spike proteins, and then it breaks it down and you excrete it. So it doesn't stay in you for a long period of time.
Awesome. Okay. Sorry.
So, one thing I will mention, and again, this is just my own sort of personal passion, is Black and brown people have often been unrepresented in the research they do and in the work they do for science. And I don't know if anyone's ever heard the story of Onismus, but Onismus was a Black slave, and he was a slave of Cotton Mather's back in the early 1800s. And it turns out Africa had during the smallpox epidemic,
Yes.
Africa had something called variolation. And variolation was a precursor to immunization. And it was Onesimus who told his owner at the time, Cotton Mather's, about variolation and how it worked. And that was one of the reasons the smallpox vaccine was created. And of course, Cotton Mather's took all the credit, but it really was one of his Black slaves who had the solution. Also, I don't know if anyone's heard of Kizzmekia Corbett, but she's a prominent NIH African-American scientist. She was one of the leaders in developing the Moderna vaccine. So, if you want to hear from someone from the Black and brown community, she has podcasts, Google her. She speaks much more powerfully and much more passionately than I do about the vaccine, and she's a real believer.
Yeah, I had learned about both. One about the slave. I think it was in South Carolina in the Geechee territory that this took place in. So I had learned that in my doctoral program this past year, and I had a chance to be on a Zoom call with the doctor you just mentioned. I always pronounce her name incorrectly.
Kizzy, they call her.
And so I think it's important. I'm grateful you mentioned that because particularly in our community that we are always under the assumption that persons don't have our body chemistry in mind, quote unquote, particularly because of what has taken place in our country, whether it has been with Henrietta Lacks, whether it has been with the Tuskegee experiment. As a people, we have, as you said earlier, reasons justifiable for hesitancy. But again, it is critical that we look past what has happened and recognize that the vaccine is not to hurt any particular demographic or person, but it is to keep us healthier and safe as possible. Again, if you have questions or comments, Terry and I are here for a few more moments. We're grateful for, I'm grateful, Terry, for your years of experience and expertise in what you have provided for the community of Ossining at large in our surrounding areas, as well as to the NAACP and Star Bethlehem in this area. I do have a question to kind of jumpstart a conversation real quick. I know that lots of persons, even in my family, the adults had become vaccinated, but the teenagers and children had not gotten vaccinated. Parents were hesitant about giving their children vaccination. I know that they're even now, if not already, approving a vaccine for children 5 and under, I believe it is. And so, can you speak to a parent, a grandparent, a guardian who has got themselves vaccinated or considering it, but still hesitant about having their kid, or grandchild, become vaccinated?
Sure. Well, one of the things we talk about is the difference between emergency use authorization and EUA by the FDA and approval. And right now, the Pfizer vaccine, and it's only Pfizer because they have the money. They're the ones going in front of, the FDA quicker. Moderna follows behind, and Moderna has better numbers than Pfizer with regard to efficacy. But there's an EUA for 5 through 17, which means it's authorized but not approved. All that means is it's going to take a little bit more time to get approved because they need to do even more studies to go from authorization to approval. Now, one of the reasons people don't vaccinate their kids is because kids don't usually get super sick. And they say, isn't it better to get it over with? But reason kids don't get super sick is because they're not fat, they don't have diabetes, they don't smoke, they don't have hypertension. But that kid could give it to grandma, and grandma could die. That kid could develop MISC, multi-inflammatory multi-system inflammatory syndrome. And they found the vaccine is super, super good at preventing that complication. And that's really the only serious complication that we have for people, for kids. I have some statistics. I'm just scrolling down. 91% reduction in the likelihood of MISC, that complication, and 95% of children hospitalized with MISC are unvaccinated. So there's no data that suggests any deaths in children were caused by the vaccine. And there have only been 5 children who've been hospitalized after getting vaccinated, and they all had other conditions like appendicitis or strep. So it's been found to be safe. And although it's not quite as, necessary because kids don't usually get sick and die, unfortunately, we vaccinate for 3 reasons. We vaccinate for ourselves, we vaccinate for those we love, and we vaccinate to get back to a more normal life. And it will take vaccinating kids to do that. My daughter is a 2nd grade teacher in the Bronx. She absolutely loves her kids. She's fully vaccinated. She got COVID 4 days after spring break, and she said, there were just too many hugs, Mom, but I love them too much. So, you do it because you just don't know who a kid is going to pass it on to. And your kid could be the unlucky one who gets super sick.
I think that's great. I know you're not a Baptist preacher, you're Unitarian in faith, but in the Baptist church, we usually get 3 points for our sermon. And so you are, we grandfather you in on today as a unofficial member of Star. Terry, thank you so much. Again, if you have a question, throw it in the chat very quickly. If not, we're going to conclude this much needed and informed conversation on today. It relates to COVID vaccination and hesitancy, particularly for those in the brown and Black community. Again, I want to say this, and Terry, I know you'll say this in any closing remarks, that if you have not gotten vaccinated, please do so. Vaccinations are available, as we said, in local pharmacies in our community. Of course, also you can call your doctor, and I believe, and go that route that way there for those of a PCP. It is critical that you get vaccinated and boosted. Matter of fact, I'm sure that they're really pushing the fact that a full vaccination is not just your 2 shots or 1 J&J, but probably going to be in the near future your boosted shot as well as I don't, am I saying that right, Terry? About probably looking to say if you're not vaccinated, if you don't have your booster, you're not fully vaccinated.
Right. The boosters, especially with Omicron, have been found to be really, really important. Less so with Alpha and Delta, but now with Omicron, the boosters really make all the difference. And It's just such a quick little poke. It really is. And most people, if they get side effects, it's that second vaccine. The booster, it really usually is pretty mild. I didn't notice anything except a sore arm.
Yeah, we have a comment in the chat. A person mentioned, I'm going to read it because it's kind of hard to read it on the screen. Says, I disagree with when it comes to people of color or white people. People have to make their own mind and view on this virus. Speaking for myself, I choose not to take the vaccine because of the pressure from the new I'm saying this is new in community. When I went ahead and got the shot, as soon as I received, I guess this member person received the vaccine, they got vaccinated, took a shot. Within 3 days, their body began to start to go downhill, hurt, and so they had some severe complications from having their vaccination. So she said, of course, I'm sorry I gave into the news pressure. People should follow their own mind. What do you say to persons who say, hey, I or a family member had a really negative reaction to the vaccine, and I'm hesitant now, or I'm telling people not to get it? What do you say to those who have had that experience?
Well, first and most importantly, I'm sorry you had a bad reaction, and I hope you feel better now. I mean, most people who have a vaccine reaction, it is short-lived. Most people who have COVID, it's not like 100% vaccine is perfect. It's, there are risks to vaccines. I'm happy to speak with you offline if you'd like to. I think, a lot of people who think they have a serious thing happen after the vaccine, it may or may not be related to the vaccine. I'm not certainly diagnosing you, your doctor can do that. And we do all get to make our own individual decisions, but these decisions affect everyone. So, we want to get through this pandemic. We want to be singing and hugging those people we love. And the fewer of us that are vaccinated, the longer it'll take for us to get there. So, people go into the army for their country and risk their lives on a daily basis. This is the COVID army that we have to join if we want to kick this virus to the ground. And I do realize that's a value judgment, and not everybody agrees with me. It's just where I'm at.
Understandable. Another question. Christine Jackson says, good evening. I just came in and not sure the question been asked or answered. She said, I'm vaccinated but caught COVID last month. Is it okay to get the booster now after having COVID?
Yes, there's no medical contraindication to get the booster, but chances are you have some good protection from being vaccinated and have COVID. So every doctor is a little different. I tell my patients wait a month. Some doctors say wait 2 months. But, normally we used to say it's okay to wait 3 months, but Omicron, people are getting sick after 6 to 8 weeks. So it's definitely safe to wait a month. Not that there's any danger in doing it now, but you're just elongating your timeline. If you want to go somewhere fun over the summer and you wait a month, you're going to have more antibody juice in your system in the summer than if you do it right away. But there's no medical reason not to do it as soon as you clear isolation and feel mostly better.
Okay. And so that's that nuke. I know that when I first received, and I call it the cocktail, I don't know, Remdesivir, when I was hospitalized with COVID. So before I received my first vaccination shot, I had to wait 90 days, I believe it was, or 3 months.
Yes, if you've had convalescent plasma or monoclonal antibody treatment during your vaccine, you have to wait 90 days.
Gotcha.
At the beginning, we were waiting 90 days for Remdesivir. Now we're not anymore. But if you were treated with monoclonal antibodies or convalescent plasma, then you do have to wait 90 days.
Okay, so those who are hospitalized with that is very different than those who just had COVID, stayed at home, kind of nursed themselves back to health. Okay, great. Again, this has been an amazing conversation. If you have another question or comment, please drop in the chat very quickly. Again, we are grateful to Terry Lunkin, who is a nurse practitioner in our community here in Ossining, who has given her time and her attention to really helping to help those who have been anti-vaxxers understand the proper information. Because with the disinformation campaign that has gone out nation and worldwide, we want to make sure that we have informed persons who are part of our community. We do recognize that getting vaccinated is a personal decision. that for many persons, it is a personal choice. We pray, as she said, that you get vaccinated for yourself, for your family, and so that things can get back to normal. And so I know even for me as a pastor, I miss hugging the members. And it's been a struggle even with funerals, having to tell people you got to sit every other row and don't hug or console a person. And people look at me like I'm crazy. But like you said earlier, and I've said even before, we don't want to create super spreading events. We want to make sure that we are being as safe and as healthy as possible, so that nobody else has to get COVID, who when it could be prevented as much as possible.
Thank you. And I was to start Bethlehem for my NAACP meetings, and I could thank you for offering us that space. And I can't wait to get back together with everybody.
Yeah,
This has been, a miserable 2 years. And, I think Omicron in the Northeast is starting to go down. Things are starting to get normal. You never know what's going to happen next, but hopefully, if we all, and again, it is right for everybody, but not everybody wants to do it.
right.
But hopefully, we can talk, and people who are reticent, talk to their doctor, talk to Pastor Jones, talk to your pharmacist. The more information you have, the better decision you're able to make.
Awesome. Again, as we close out on today, I want to let those know, and persons already kind of know in our congregation that Star Bethlehem, we are so much in support of vaccination that we have decided as a congregation, as leaders, that entry into the building for large-scale events, for services, for activities, requires proof of vaccination and or a medical exemption from your doctor. And so it is our prayer and my hope that whether you're a member of Star or not, that you would love your neighbors, you love yourself, and that you would get vaccinated. Even with your vaccination, I want to remind you, please continue to socially distance. Please continue to wear your mask, because those things help, in addition to the vaccination, to preventing the spread of COVID-19. We want everybody to be healthy and safe. We've buried enough people in the last 2 years. We want everybody to live and have a long life and prosper as our soul may prosper in the Lord. Terry, again, thank you so much for your time. For those who have viewed this video, thank you so much. We will leave it on our website as well as YouTube and Facebook for those who want to come back later and get more information. Terry's information is available. I'm going to throw her contact information on the screen one more time for those who may want to get in contact with her personally, so that you have questions or comments about it, that you can do so. Again, Terry, thank you so much for your time on today. Thank you for the work that you do through the NAACP. And I pray that everybody's blessed and be a blessing. Take care and God bless.
Thank you.